always thought hospice was the H word.
People always ask me if my job is depressing.
I think people feel that hospice is dark. It's not always a burden or something scary when hospice steps in. It's a good thing.
Oh, it's made a heck of a lot of difference. I don't even know how to describe it. But my first reaction when they took me off was, how am I going to get a shower?
I would say hospice is like putting on your favorite pair of slippers and going home.
Let's not see this as the closing of a story, but the continuing of a story in a different realm.
There are two ways to spread light. You can either be the candle or you can be the mirror that reflects it.
Hospice came in when my dad was diagnosed with a brain tumor.
The reason we wanted hospice or needed hospice was we wanted to bring my husband home. He wanted to be home. We wanted to be in a familiar atmosphere. And hospice was the only way we could bring him home.
They did an excellent job with us. They held our lives together. It was almost like, I don't even know how to explain it.
I was happy that hospice was coming in because I know we couldn't do everything on our own, especially with his pain, and we didn't want him to suffer, but we didn't want him to be in the hospital anymore because that's not where he wanted to be.
We had a wonderful nurse, Louise. She was assigned to my husband's case, and she spent the first couple of days that he was home, she spent a lot of time trying to regulate his medications.
When we first went in, when I first met Arnie, he was so sick. And he had been sent home from the hospital, and there was his wife, watching him feel so awful and so sick.
She was able to work with a pharmacist, and they got the pain under control, the nausea under control, and he was able to eat and start to enjoy his life again.
I wasn't in class every day. Of course, with that situation, that's not your first priority.
While dealing with a father who's dying at home, to have to manage your junior year in high school can be really difficult. And so my job was to help her in school and to advocate for her.
The next day when I went back to school, it was a completely different environment. It was a weight lifted off my shoulders. So.
It would have been impossible without hospice. My mom actually took a lot of time off work and stayed home with him, but even with her there 100% of the time, she can only do so much.
I'm so glad that we decided to go with hospice. I mean, the last few months we had with him were wonderful months that we wouldn't have had we not gone home and had hospice support us.
I still can't believe that I lived to be this old. And I still say, God has a plan for me. And I just wish he'd say one day, this is it, Al. This is the way you do it, so get it done.
Albertine came to us a very fiercely independent woman, very full of life, very community-oriented. And one of the things we needed to do was to really listen to what it was that Albertine needed.
But I think it was the fact that I could no longer take care of myself, and to have someone help me physically, I just couldn't buy. I still can't believe I have to have help.
And we found out some really fun things together. We found out that she loved pets, so we'd have a pet come and visit her. We found out that she liked a glass of wine at night. And so we got a doctor's order to allow her to have a glass of wine at night because that's how she relaxed in the evening.
But hospice to me is an interaction with the outside world. Keeps me in touch with what's going out there, information like crises around the country that we discuss all of that, and they advise me on conduct because I'm a little short-tempered, and once in a while, my mom always used to say, keep a smile on your face and your big mouth shut, and I forget that.
We did very person-centered care with her, and she is just she's one of our biggest fans because we have allowed her to chart her own course.
There's a different feeling with hospice and and I have wonderful close friends. It's like we're doing you a service, but we're doing it because we want to. There's no stress, and I love that.
I really believe that hospice is instilling hope and walking into people's lives at a very difficult time where things are very dismal and dark, and be able to show them that, you know what, the end is not here. You've got today.
I became familiar with hospice, I guess it was like 17 years ago when my father-in-law died. Kind of stored it in the back of my mind, and 17 years later, now I'm a volunteer.
Initially, I did not know a lot about hospice. I enjoyed music and played the guitar, and so I actually just called up Spectrum Health and said, is there any opportunities to come and play for some of the people just in the hospital? And that's what I thought I might do. And they said, there's this great program that hospice has for bedside musicians. You might want to check that out.
It's an honor for me to sit there with them and hear their stories and just be present with them. So I don't think now, why do you volunteer for hospice? I think, how could I not volunteer for hospice?
I've said many times to many people, I don't know where they get the people that they have, because they're people, you just don't meet people like that.
I've been working with HELOISE for a couple years now. Sometimes I won't even maybe bring in my guitar or sing, but she just wants to talk and hang out, and I read letters to her. I read some of the Bible verses because she can't see or hear that well. And it's just become so much more than just playing music for her. It's really a relationship.
One word to describe hospice is pretty tough.
I'm not sure how to answer that.
Boy, it's a hard one.
Hospice is
not just a thing or a service, it's a whole way of looking at life.
That they're there to help.
A friend for the journey when the journey is almost done.
Hospice is a stepping stone, in many cases, to what's next.
Hospice is hope for reconciliation and for peace.
I'd like to assure people that hospice is going to respect them, and that hospice is going to do what they want, and we're not going to impose our values on them. I think it's very important, especially, when people are dying, that they have as much autonomy as it's possible for them to have, and be able to do it the way they choose to. It's never hospice's role to prescribe how one's death should take place.
It's about listening with your heart. It's about doing what it is that they need to live the last days that they have with dignity and compassion.
I think the biggest misconception about hospice is that it's an ending to someone's life. And it's not. It's almost a beginning to the next phase in their life.